So today's topic is thyroid disorders. Those who are joining late, please help them out with the topic name. Not from the textbook, okay? In the textbook, thyroid disorders are not mentioned. Just briefly, they have mentioned in the iodine chapter. But thyroid disorders and diet in thyroid disorders are not mentioned, okay? So we'll just brief through that. In detail, we will take about hypothyroidism and hyperthyroidism and other diseases as well, iodine deficiency as well, okay? About the National Iodine Deficiency Disorders Program in the dietetics chapter we'll take, okay? Questions regarding that will not come in the exam, but you should have some awareness about the national nutritional programs, okay? So in detail, how it is covered, which states or geographically which areas come under the goiter belt, okay? Those we will discuss in the dietetics classes, okay? Not here. So diet we'll discuss here. What are the different types of thyroid disorders? That also we'll discuss here, okay? So if anyone is joining late, please help them out with the topic name. So thyroid disorders, symptoms, it depends on what kind of thyroid issue you are facing. Are you overproducing the hormones or are you underproducing it, okay? Is it too much or too less? And some thyroid disorders are autoimmune, okay? Hashimoto's, Cushing's and all, they come under autoimmune disorders. So medication options you have, okay, medications, or in case of tumors or cancer, surgical removal, okay, and other therapies are also there. So these are the treatment options, okay. Depends on who is the doctor and what kind of medicines you are going to take, okay. So that comes under thyroid disorders, okay. So we'll discuss about this in brief. So what does the thyroid do? So thyroid is a butterfly-shaped gland which is located in front of the neck. Okay, it produces hormones that play key role in regulating blood pressure, body temperature, heart rate, metabolism. Okay, these are the areas where the hormones naturally function. Thyroid hormones naturally function. The key element here is your metabolism. Okay, so this is the image of how thyroid gland kind of looks like. Okay, it's a butterfly shaped gland in front of your throat, okay, located in front of the neck, just before the trachea, okay, in front of the trachea. Behind the thyroid gland, you can see here, you have parathyroid glands. Am I audible? Just a second. Yeah. Am I audible now? Is my voice clear now? So yeah, thyroid gland is a butterfly-shaped gland located in front of your trachea, in front of your neck. Okay. So main functions of thyroid to maintain your body temperature, your heart rate, your metabolism. Okay. And even the way how other hormones react to your body, thyroid hormones have a control over that as well. Okay. So how is the thyroid hormone getting produced? There are other glands involved in the production of thyroid hormone. Okay, the hypothalamus, which is located just below your pituitary gland. Okay, in your inside your brain. Okay. So hypothalamus will secrete the thyrotropin releasing hormone. Okay. Thyrotropin releasing hormone will further ask the hypothalamus to secrete thyroid stimulation hormone, TSH. Okay. And only when the thyroid stimulation hormone is getting released, thyroid gland can produce T3 and T4. Okay, these are the two types of thyroid hormones, T3 and T4. Triiodothyroxine, okay, and tetraiodothyroxine. These are the names of thyroid hormones, T3 and T4. So your gland, like hypothalamus gland, is also involved in making the thyroid gland secrete these hormones, their own hormones. Okay. So when you do a blood test, when the thyroid panel blood test is done, the level of TSH, TRH, T3, T4, that will determine what kind of disorder you are facing. Okay, what kind of thyroid issues you are facing. Okay. Functions. Now coming to the functions of thyroid hormones. First is your general metabolism. Okay. Increase in the metabolic rate, oxygen consumption of most tissues in the body, except your testes, uterus, lymph nodes, and anti-pituitary gland. Apart from these areas, all the other tissues, if they have to take in oxygen, okay, and metabolize it, produce energy, that is one function. It also increases the synthesis and activity of various enzymes, okay, the production of enzymes, and also making the enzymes work. Thyroid hormones do have a function there as well. Increase the size, number, and activity of mitochondria. The more mitochondria you have within your cells, more will be the energy production. Okay. When more energy is produced, you are burning the calories. That's how weight management is achieved. Okay. It depends on the number of mitochondria that you have. Then coming to lipid metabolism, thyroid hormones also have their role in lipid metabolism. All aspects of fat metabolism is increased. Thyroid hormone can help accelerate the oxidation of fatty acids in the cell, which means take the fatty acids away from the adipose tissue, make the cells use it, make the cells burn the fatty acid. So you are losing weight. Okay. Adipose tissues, adipose cells are tissues in which your fat is stored, body fat is stored. Okay. So thyroid hormones can pull the fat out of this adipose tissue, push it into the cells, make the cells burn the fatty acids. That is oxidation. Okay. Burn the fatty acids and produce energy. That keeps you lean. Okay. That helps in weight management. It lowers the level of cholesterol, phospholipid, triglyceride levels in the blood, because automatically all these are fatty acids. Cholesterol is a fatty acid. Phospholipids are a type of lipid fatty acids. Triglycerides are fats. Okay. So when these three different types of fats are getting oxidized in your cells, are getting burned up in the cells, automatically these levels will go down. Automatically these levels will go down in your blood. Okay. It also stimulates the formation of LDL receptors. Okay. LDL, LDL receptors will make sure that low density lipids are reducing in your body. Okay. Then functions. Protein metabolism is another function of thyroid hormone. Small doses of thyroid hormone can also increase the rate of formation of proteins by your RNA ribosomes. Okay. It can also increase the RNA synthesis by your genes as well. Production of more RNA in your cells. Okay. And large doses of thyroid hormone can lead to too much of catabolism of muscle protein. That is too much of breakdown of metabolism, muscle protein. So that is the reason why in hyperthyroidism, the person is not able to put on weight. Okay, they'll keep losing the weight, not just the fat, but also their lean muscle weight is lost. Okay, too much of thyroid hormone will break down the muscle protein also. That's how they become very thin, extremely thin. Okay, they are not able to hold on to their body weight. Okay, that is the function of protein metabolism by thyroid hormone. So far, is it clear to all? Am I audible now? Is my voice okay, fine now? Am I audible? Is my voice clear now? Then coming to the systemic functions, okay? The systemic functions of thyroid hormone. Gastrointestinal system, it increases the secretion of your digestive juices and also the movement of food within your intestine. Okay. So this makes you feel hungry. It will also make sure that you're eating food. There is an appetite in you. Okay. There's a hunger in you. It is necessary for hepatic conversion of carotene to vitamin A. Okay. Carotene is from plant-based sources. Carotene is a type of vitamin A from plant-based sources. Your body cannot store carotene. It has to be converted to vitamin A. Okay. And this conversion takes place in your liver. Okay. So, for this conversion to take place, thyroid hormone should be present. And if you don't have enough thyroid hormones, this keratin will not be able to will not be converted into vitamin A. If it is not converted to vitamin A, it will not be stored in the liver. Okay, because liver stores vitamin A. Okay, so if the keratin is not able to be stored in the liver, it is already inside your system. Where will it be? It will be roaming in your blood, and that's how you get kerotinemia. Okay, too much of keratin in your blood. Okay, so that happens in some severe stages of hypothyroidism. Okay, then reproduction. Essential for normal menstrual cycles and fertility. Also, it increases the milk secretion during lactation. Okay, in lactating women, if they have enough amount of thyroid hormone, it encourages more milk secretion, milk production as well. Okay. If thyroid hormones are disbalanced, menstrual cycle will also be disbalanced. And it can also lead to fertility issues. So that is the importance of thyroid in the reproductive system. Coming to the growth and development. In children, normal tissue growth, soft tissue growth, skeletal tissue growth, that is the bone growth. When there is a growth in the skeletal tissue, there is an increase in height. Okay. It is also required for the production and action of growth hormones. Okay. And growth factors, immunoglobulin factors as well. For the respiratory system, respiration increases with increase in thyroid hormone. Okay. Dissociation of oxygen from hemoglobin by increasing the amount of 2,3 dpg in RBC. That is a bit more technical. Okay, it helps the hemoglobin to release oxygen. Okay, remember hemoglobin carries oxygen. Okay, in RBC you have hemoglobin that carries oxygen. So hemoglobin has to to release the oxygen, dissociate the oxygen into the tissues, into the cells. Okay, for that dissociation, thyroid hormones are required. Okay. Then cardiovascular, your heart and blood vessels. Thyroid hormone will help increase the number and affinity of beta-1 adrenergic receptors in your heart. Okay. This is the name of the receptor in your heart. Okay, which can be more sensitive towards catecholamine. That's a neurotransmitter. Okay, like when you are feeling happy, okay, your heart beats faster. Okay, when you are feeling anxious or stressed, that time also your heart beats faster. It's the heart's response to catecholamine. That's a neurotransmitter. Your brain secretes these proteins, these chemicals, okay, to which the heart responds. Okay, so that's why in your mind, in your brain, you're feeling anxious and stressed, but you can see the effect of it in your heart. Your heart is beating. Okay, it is when the heart is beating fast, when you're afraid, when you're scared, or when you're excited. Okay, your heartbeats go up. Okay, that is the heart is getting the reaction through catecholamines. Okay, increase the rate of blood flow in the skin for heat elimination. That is how thyroid hormone will function with the blood vessels. Okay, the blood vessels will dilate, especially the blood vessels that are on the periphery, very close to your skin. Okay, those blood vessels will dilate so that there is more blood flow towards the uh, towards the skin. Okay, and if there is more blood flow towards the skin, blood is 90% water. Okay, so it carries heat of your body. So when it comes very close to the skin, this heat is eliminated. Okay, so that's how thyroid hormones will help in heat elimination from the body. Okay, it can increase the cardiac output as well. Systolic BP increases, but the diastolic BP goes down. Systolic BP means when we say what is a normal blood pressure. Okay, usually people will say it's 120 by 80. Okay, it's a normal blood pressure is usually a range. Okay, from 100 to 130 is the systolic range. Okay, from 60 to 90 is the diastolic range. It's a range. Okay, normal blood pressure is a range, but usually we say 120 by 80 is the average normal blood pressure. So what is this 120? 120 is the systolic blood pressure. 80 is the diastolic blood pressure. What is the difference between systole and diastole? When the heart is contracting, okay, when the heart is beating means it is contracting and relaxing, right? When the heart is contracting, what blood pressure you have, that is systolic. When the heart relaxes, what blood pressure you have is diastolic. Okay, so thyroid hormone will increase the systolic BP, but it will decrease the diastolic BP. Okay, it will increase the BP even further when the heart is in the contracted state. It will go down further when the heart is in the relaxed state. Okay, increase in the pulse pressure as well. You have pulse points in your body where you can feel the pulse. Okay, the moment of the blood pounding on the walls of your blood vessels. Certain arteries, you can feel that. Pulse pressure is usually felt in the arteries. Okay. So pulse pressure also increases. Coming to the nervous system, promotes growth and development of your brain. It is required for the myelination and development of nervous system in infants. Okay, when normal myelination takes place, myelination is the formation of myelin sheath. Okay, the axons and all. Neural development that takes place in the infant. Okay, it's like a childhood milestone. When the child is born, okay, the parents will closely monitor when will the child fall on their stomach on their own, crawl on their own, okay, hold things, learn to release things, learn to point things, identify people, okay, use their own strength to stand up, take the first few steps. Okay, these things, if it has to take place at a normal pace, and it has to come up, develop at a normal age, no, myelination of the nervous system has to take place. Okay, slowly nervous system develops during the infancy, and it's because of normal myelination and all. Okay, it's much more complex formation of the nervous system. Okay, increased response of the brain to catecholamines and increased activation of RAS receptors as well. These are also receptors in your brain. Okay, when catecholamines are released, your brain has to respond to it. Epinephrine, norepinephrine, dopamine, these all are catecholamines. Okay. When your brain is not responding to these catecholamines, that's when we say the person may go into a stage of depression. Okay. The person is too anxious, depressed. Okay. Or show exhibiting some maniac symptoms. That is disbalance of the brain towards catecholamines. Usually it leads to depression. Okay, epinephrine, norepinephrine, and serotonin, they are supposed to uplift you. They're supposed to give you the boost of energy. It should be able to excite you. But if the brain is not responding to these catecholamines, you don't feel excited. Whatever happens, even if you receive a good news, don't feel excited. You don't feel happy about it. Okay, because the brain is not responding or not receiving the catecholamines. Okay. So what causes thyroid problems? So problems with thyroid can be caused by iodine deficiency, autoimmune disorders, your own immunity attacks the thyroid tissue. Okay, like Hashimoto's disease, Graves' disease, they are autoimmune thyroid disorders. Then inflammation, thyroiditis. Okay, it could be painful, it could be non-painful, depending on the triggers, what is triggering the inflammation. Okay, if it is an infection and all, it could be painful. If there is a foreign invasion, okay, bacterial infection, viral infection, that could be painful. Okay. So thyroiditis, it can be either painful or it cannot be painful, depends. Okay. Then you may have cancer or nodules. Nodules could be benign. It can turn malignant as well. Okay, benign, like it's a tumor. It will not spread. Okay, malignant means it is spreading. That is cancer. Okay. So having thyroid nodules can also lead to thyroid problems. So treatments, in case of cancer, you have radiation therapy, thyroid surgery, medications can also help. Okay. Then occasionally pregnancy can also cause thyroid issues. Either the woman was having some minor thyroid issues before pregnancy and pregnancy aggravated it. That can also take place. Okay. And if it is left untreated during pregnancy, if thyroid issues are not treated, it can lead to miscarriages, premature birth, low birth weight babies. It can also affect the baby's brain development. Okay. And if a woman is pregnant or planning to become pregnant, and if she has a thyroid issue, she has to consult it with the gynecologist, with the doctor, what medication should be continued, what should not be. Okay. So when you have to check with the doctor, when there is a symptom, when there are symptoms of overactive thyroid, so at that time, symptoms we will discuss. Okay, that's when you will know when you have to consult a doctor. Symptoms of underactive thyroid: if there is a lump or swelling in your neck, if you are concerned about thyroid problems during your pregnancy, okay, or always refer a doctor for medications. So these are the symptoms of hypothyroidism and hyperthyroidism. Hypothyroidism, you will have cold intolerance, decreased sweating, weight gain, constipation, depression, irritability, irregular or heavy periods, very slow heart rate, brittle nails, muscle or joint pain, puffy face. Okay, that is hypothyroidism. Very common. Hypothyroidism is more common. Hyperthyroidism, that is overactive thyroid, it's very rare. Okay. In hyperthyroidism, weight loss, again, very short periods, light periods, increased sweating. Nails will become thick. It may flake as well. Heat intolerance, bulging eyes or puffy eyes, racing heart, diarrhea, muscle weakness, anxiety and nervousness because hyperactive uh, thyroid, heat intolerance. Okay. They keep on sweating, so they cannot tolerate heat much. Insomnia, not able to sleep. Okay. Fatigue, tiredness, and hair loss is common in both these cases. What are the complications of thyroid problems? An enlarged thyroid or goiter may cause problems with swallowing and breathing. Graves' disease, it can cause eye and skin problems as well. And overactive thyroid can lead to issues like heart problems, rapid heart rate, okay, problems with your cardiac rhythm, heart rhythm, cardiac arrhythmias, heart failure, osteoporosis, okay. So what kind of thyroid issue you are diagnosed with? There are different complications to it, okay. Infertility being a common complication to in both these cases, okay. Underactive thyroid, that can also cause complications like high cholesterol, high blood pressure, heart problems. Some complications of thyroid disorders that will require immediate medical attention. Okay, you may have to rush the patient towards the ER emergency. Thyroid storm. Okay, this is how it looks like. So thyroid storm is too much of thyroid hormone is secreted by the thyroid gland. Okay, the patient may have a fever, rapid heart rate, vomiting. The person would be delirious. Okay, cut off from the reality. May have some delusions and all. Okay, so that is a thyroid storm. The patient may look like this. They are in the shock. Their eyeballs are bulging out. Okay, so that is a thyroid storm. Immediate medical attention is required. Emergency treatment is required. Then myxoedema coma. It's a rare but life-threatening condition, which is caused by untreated and severe hypothyroidism. If you're not treating your thyroid issues, it can lead to myxoedema coma, and it causes drowsiness that can lead to unconsciousness, slow breathing, low body temperature. Okay, edema all over the body, pitting edema around your orbital region, around the eye region. You can see in the image the difference between both these images. You can see how different they look. Okay, the eyes are completely getting closed because of the edema, periorbital edema, if you can see. Okay, the entire face is swollen, severe hair loss because of untreated hypothyroidism. So far, is it clear to all the complications? These topics are not from the page, like not from the textbook. Okay, these are additional classes. You will not find these contents in the textbook. Then thyroid diseases. Am I audible to all? Thyroid diseases, it includes hypothyroidism, hyperthyroidism, thyroid nodules, commonly seen in most primary care and endocrinology OPDs as well. Both these conditions are seen. Okay, in an OPD visit also you can get the thyroid panel test done. Okay, and from any general physician you can get a consultation or referrals towards endocrinologist. The evidence is strongest for adequate but not excessive iodine intake. Okay, to benefit thyroid health in general. Okay, you have to take adequate amount of iodine, but not too much of iodine. Too much of iodine can also lead to hyperthyroidism. Okay, so so far whatever researches we have, evidence-based practical medicine that has been followed is adequate amount of iodine intake is beneficial. Okay, excessive can be detrimental. Okay. As well as selenium, iodine and selenium are the only nutritional supplements that have been associated with thyroid disorders. Okay. In the treatment of thyroid disorders, diet-based treatment of thyroid disorders. So aside from these, there is a sparse scientific data showing that dietary changes can significantly benefit hypo and hyperthyroidism. There is not much significant studies or significant evidence-based studies that we have, which encourages you to take a specific diet, only then you can cure thyroid. Okay, if you come across some articles, don't come blindly believe that. Okay. So hypothyroidism, just a second. Sorry for the break. So hypothyroidism, it affects 7% of the general population. Okay. It's more common than hyperthyroidism. Iodine deficiency is the leading cause of hypothyroidism globally. Okay. Various regions, not just in India, all over the world, various regions may be considered as the goiter belt. Okay. Levothyroxine as a thyroid hormone replacement remains one of the most commonly prescribed medication. Many foods and substances also interfere with the intestinal absorption of levothyroxine. So usually doctor will tell you not to eat levothyroxine or along with your meals. Okay, when you're taking some meals, lunch, dinner, breakfast, don't have levothyroxine with that. Don't have levothyroxine with your lunch, dinner, or breakfast. Okay, you have to have it in between, any time between. Okay. So the symptoms of hypothyroidism, thinning of hair, hair loss, puffy face, coarse and dry skin, even hair loss from your eyebrows. Okay. Enlarged thyroid gland that is visible sometimes. Even when you swallow, the doctor or general physician may ask you to swallow your own spit, and they will see a movement in your throat. Okay. And sometimes even you can palpate and understand that there is a lump in place of your thyroid gland. Okay, that can also be an indication of hypothyroidism. Slow heartbeat, heart rate is very low. Okay, it is very difficult to get the pulse to get the pulse in hypothyroidism cases. Dry and coarse skin, poor appetite, constipation, cold sensitivity. They cannot withstand cold. Okay, even if it's a 24 degrees Celsius, if you're keeping your conditioner in 24 degrees Celsius, that is also too cold for them. Okay. Swelling in the limbs, Carpal tunnel syndrome. Carpal tunnel syndrome is not very common with hypothyroidism, but if it is not treated, that can lead to carpal tunnel syndrome. Okay, like carpal tunnel syndrome is usually associated with people who have who are painters, writers, okay, who do any skilled work or labor which requires repeated hand movements. Like in painting, if you see painters, okay, the way how they paint or do their work, it is a repeated hand movement. Hands are going up and down in a repeated manner, and that can cause inflammation, okay, in the joints, which is getting repeatedly moved in one direction. Okay, usually it happens in your fingers, in your wrist. Okay, uh, it is only around your hands, not up to your elbows or shoulder. Carpal tunnel syndrome is usually in your fingers and in your wrist area. Okay, it's very painful. After a while, they are not able to move that freely. Okay, also people, musicians who play instruments, guitarist, violinist, and all. Okay, again, they have to do repeated movements with their instrument, tabla players and all. Okay, so they will not be able to perform their art anymore when carpal tunnel syndrome affects them. Okay, it's the disease condition of the joint skeletal system usually, and also the nerves are also involved. Then infertility, irregular periods. Okay, so these are the disease symptoms of hypothyroidism. Yeah, nerves are also involved in carpal tunnel syndrome. Then hyperthyroidism, it is present in, it is very rare. 1.3% of the general population only suffer from hyperthyroidism. Graves' disease is also a leading cause of it. Graves' disease is also a leading cause of hyperthyroidism. Okay, but other risk factors also include that if you have too much of iodine in your system, okay, there are too much of nodules, small tumors in your thyroid, that can also produce more thyroid hormones. More thyroid tissue means more thyroid hormones. So what is a tumor? It's more of the tissue of that particular organ. That will also start producing more thyroid hormones. Thus, it leads to hyperthyroidism. Okay. Yes, men can also suffer from thyroid issues. Okay, women are generally more affected by it, but men also get affected by thyroid issues. So conventional therapies for treatment of hyperthyroidism, you have anti-thyroid medications, radioactive thyroid treatment, thyroid surgeries. These are the therapies which can treat hyperthyroidism. In case of nodules or tumors, surgery is the best option. You have to remove the nodules or surgically remove the tumor. That can give relief. Okay, in some cancerous cases, removal of the thyroid gland is also suggested. Complete removal of the thyroid gland or partial removal, that can be suggested. So again, coming to the symptoms of hyperthyroidism, we have discussed this earlier as well. Hair loss is there, bulging eyes will be there, frequent sweating, too much of sweating because they can't withstand heat. Hypothyroidism, they can't withstand cold. Hyperthyroidism, they can't withstand heat. Okay, enlarged liver, vomiting, diarrhea, hand tremors. Okay, Mm. Tremors is like if when you're having fever, sometimes the way how your hand shakes, right? Chills happens, no? That is how hand tremors look like. Irregular menstruation, increased appetite, abnormal heart rate. Okay, even though if you have increased appetite, you're eating more, your body is not able to hold on to that weight. Okay, body is in a state of catabolism. Breaking down its own fat deposits, breaking down its own uh, lean muscle tissue. So the body is not able to hold on to weight. Okay, that leads to excessive weight loss. The difference between hyper and hypothyroidism is clear. Is it clear to all? Then iodine, dietary iodine and selenium are also the micronutrients that can modify the thyroid antibody titers when you are uh, suffering from hypothyroidism. Okay, selenium supplements can also help. Then you have Hashimoto's thyroiditis. So this is an autoimmune disorder in which the body's own immunity is attacking the thyroid tissue. Okay. And it causes inflammation of the thyroid gland because of constant attack. So it can lead to goiter, swelling in the neck. Goiter can be painful or it cannot be painful as well. It depends. Not always the goiter, if it is enlarged, it's not always painful. Okay. And other symptoms that come with the hyperthyroidism is also seen here. Okay, heat intolerance, mood changes, okay, changes in the bowel movement, sometimes constipation, sometimes it is diarrhea, tremors in the hand, okay, enlarged thyroid gland, excessive sweating, fatigue, the same symptoms that we see in hyperthyroidism, the same thing is seen in Hashimoto's thyroiditis as well. It's an autoimmune disorder. Okay. Then you have thyroid tumors. So thyroid nodules and adenomas, small non-cancerous growth, okay? They start in the cell layer that lines the inner surface of the thyroid gland, and then slowly it can spread out, okay? Adenoma, any cancer in which your secreting glands are involved, we call it adenoma, okay? Since thyroid is also a gland which secretes hormones, it's called adenoma. Any tumor there is called adenoma. Okay. Am I audible to all? Is my voice clear? Is it clear now? So adenoma means whenever a glandular tissue is involved in a tumor, that's adenoma. Okay, that is the medical terminology used. Okay, tumors and cancers can happen anywhere in your body. Okay, but not everywhere in your body is a glandular tissue which is secreting hormones. Okay, So whenever a gland is involved in a cancer or a tumor, it's called adenoma or adenocarcinoma. Adenocarcinoma in case of cancer, malignancy, adenoma in case of a benign tumor. Okay. So a treatment is surgery, remove the overactive nodule or remove the segment of a overactive thyroid. Okay, so that's a surgery. Surgically, you will remove this nodule because this extra tissue is also capable of secreting thyroid hormone. And that is that then there will be too much of thyroid hormones in the body. Then thyroid cancer, it occurs more common in people who have undergone any form of radiation to their head, neck, or chest. If they're treating some other cancer like oral cancers and all, naturally the radiation will hit the thyroid gland as well. Okay. Or if they're treating esophageal cancer, okay, breast cancer, brain tumors, if they're treating these situations during the radiation therapy, it can affect the thyroid tissues as well. Radiation of these therapies can affect the thyroid tissue as well, and then it can trigger another form of cancer in thyroid. Okay. So it may also occur in those who does not know their risk factors. And most thyroid cancers, it can be treated successfully. And symptoms of thyroid cancers, there is a lump that is painless. When you press it or palpate that lump, you don't feel any pain. So if this kind of, if lump is there, it's painless. Thyroid gland is enlarged because of this lump. Okay, difficulty in swallowing and breathing because if the lump is growing backwards, it is pressing your trachea. Okay, it is pushing your trachea and esophagus. So that could lead to difficulty in swallowing and breathing, hoarseness in the voice. So these are the symptoms of thyroid cancer. So thyroid disorders in women, women's thyroid diseases can affect their hormonal imbalance as well, cause problems during puberty or whenever they are suffering from thyroid disorders, their reproductive system will be affected. Okay, either in form of menstruation, in form of fertility, okay, pregnancy-based complications, or even if they have given birth, childbirth has been done, they have thyroid issues that can cause postpartum issues as well. Postpartum is after giving childbirth. Okay. Postpartum depression, excessive bleeding, mood swings. Okay. This can happen in women. Medically, how thyroid issues are treated, it's through thyroid hormone replacement therapy, thyroid HRT. Okay. It comes in form of a pill. It is usually thyroxine. Levothyroxine is the generic name of the medicine prescribed. Okay, it's a synthetic form of thyroxine hormone, T4 hormone. Okay, so this medicine will act as a thyroid hormone within your system. So hypothyroidism in pregnancy, thyroid hormones can pass from mother to fetus. and adequate amount of thyroid hormones are important for your normal growth and development. During pregnancy, you can treat hypothyroidism safely with thyroid medication. It's not that during pregnancy you can't take medication. You can take medication under a very controlled dose. Okay. If you overdose it yourself, it will affect the child's thyroid tissue. The mother is carrying the child's thyroid tissue, which is getting developed during the fetal stage, that will get affected if you're overdosing or underdosing yourself during pregnancy. Okay. So complications of hyperthyroidism in pregnancy, it can, if it is untreated, it can lead to both maternal and fetal complication like gestational hypertension, BP during pregnancy, high BP during pregnancy, gestational diabetes, okay, diabetes that happens only during pregnancy. And as soon as the child is born, there is no diabetes. But women who have undergone gestational diabetes are at a risk of getting diabetes earlier in life. Abruptio placenta will break off during the labor contractions. Postpartum hemorrhage after giving the childbirth, excessive bleeding takes place. Okay, so that are maternal complication. For the child, it can lead to abortions, miscarriages, premature birth, stillbirth. Okay, the child who is born lifeless, that is stillbirth. Low birth weight babies. Okay. Then postpartum thyroiditis. So postpartum thyroiditis is an inflammation of the thyroid gland that occurs after giving birth. Okay, and it causes hyper or hypothyroidism. It only happens during the postpartum period. Okay. Again, medication is given here. 80% of the cases with medication can resolve within 1 year of treatment of medication. And after that, they are not suffering from thyroiditis. So if the mother is suffering from postpartum thyroiditis, she may face decreased milk production, okay? Because you need enough amount of thyroid hormones. Lactating mothers, they require enough amount of thyroid hormones to produce enough milk, okay? Painless goiter, hair loss, fatigue, mood swings, okay? Postpartum thyroiditis could be genetic as well. Okay? The causes could be genetic, or they had the triggers. They may have been suffering from mild form of hyperthyroidism, but after giving the childbirth, it got aggravated. That can also lead to postpartum thyroiditis. Okay. So coming to the dietary influence on thyroid functioning, iodine, goitrogens, cruciferous vegetables, soy, and other trace minerals. These are what we'll discuss. Iodine is important. That is the most evidence-based mineral that promotes thyroid health. Okay. Apart from thyroid health, iodine has other functions in your body as well for healthy growth and development in childhood, to regulate your overall metabolism through synthesizing thyroid hormones, maintaining normal energy levels. Okay. Regulating the body temperature. These are the other functions of your iodine mineral. Okay, but mainly it has to support the thyroid gland's function in producing thyroid hormones. So the iodine, which is taken through diet, when it is circulating in the blood, it helps in the thyroid tissues to produce thyroid hormone. Common dietary sources of iodine is iodized salt, seafood, okay, and for vegetarians, seaweed, some breads, grains. Okay, iodine from plants and vegetables are not that well absorbed. Okay, although eating a regular diet should meet your iodine requirements, nutritional iodine requirements, but people who are vegetarians or vegans, okay, they have higher risk of iodine deficiency because vegetables, even though it has iodine, it is not bioavailable. Okay, once that vegetables go inside the human system, it's not that bioavailable. It's not readily absorbed. Okay, so that's why you have to use iodine fortified salt. Then goitrogens, these are vegetables or grains, food in simple language that can cause goiter. Okay. So the term goitrogen, it refers to any substance that can produce goiter, enlargement of thyroid gland. Okay. Goitrogenic substances can either inhibit your thyroid gland from producing hormone. Okay, goitrogenic substance will interfere in the pathway in which thyroid hormones is produced. Okay, so that is how goitrogen functions. There are different pathways of goitrogens to function, but that is not important. Okay, it can interfere in thyroid production, thyroid hormone production. So these are the cruciferous vegetables you can see on screen, and some soy products that are goitrogens: cabbage, turnip, kale, cauliflower, lima beans, millets, broccoli, Brussels sprouts, radish, sweet potato, tapioca, that is cassava, and soy products. Okay. So cruciferous vegetables, these are a genus of vegetables, species of vegetables, which includes broccoli, cabbage, Brussels sprouts, kale, and all, turnip, cauliflower, collard greens, bok choy. They all come under cruciferous vegetables category, are known sources of being a goitrogen. Just a minute. So they are rich in glucosinolates associated with anti-cancerous property. Okay. Uh, Even though glucosinolates are good in terms of being an antioxidant, it has anti-cancerous benefits, but still the one disadvantage glucosinolates have are they can inhibit thyroid hormone production. Okay, one way it is good for your health. It has anti-cancerous properties, but the other way it can suppress your thyroid function. Okay. So cruciferous vegetables have definitely has advantages, benefits, but regularly if you're consuming cruciferous vegetables, that too in large quantities, okay, that can lead to hypothyroidism. That can induce or lead to hypothyroidism. So it's not that you have to get scared by this cruciferous vegetable. You can have it. Okay. Once a week you can have cauliflower. Once a week you can have broccoli. But daily, two times a day, some or the other cruciferous vegetable if you are having, that can cause problem. Okay. Especially if you are already diagnosed with hypothyroidism, or you are at risk of hypothyroidism. Hypothyroidism runs in your family. If these all categories are present in your life, and then you choose cruciferous vegetables on a daily basis, times a day, that's when issues will start. Okay. Soy products as well: soy milk, tofu, soy sauce, tempeh, miso. Okay, these all contains isoflavonoids that which are responsible for inhibiting thyroid functioning. Okay, that's an enzyme. Thyroid peroxidase is an enzyme which is required for thyroid hormone production. Okay, isoflavones can inhibit this enzyme from functioning. So people who are at risk of hypothyroidism, okay, uh, they have to avoid soy products. And also euthyroid individuals. What is euthyroid? People who have normal thyroid functioning. Okay. So people who have normal thyroid functioning, and if they are living in iodine replete areas where you get enough amount of iodine from food, like all the people who live in coastal areas, okay, people who live in the coastal states, these are iodine replete areas. Okay, and among this population of people who are in the coastal areas, who all have normal thyroid functioning, okay, that is euthyroid individuals living in iodine replete areas, people living in coastal areas who do not have any thyroid issues, if they consume soy products, that will not lead to any adverse effect. Okay, soy products are bad only for people who are diagnosed with hypothyroidism and who are at risk of hypothyroidism. Not for others who do not have hypothyroidism, no risk at all. They get enough iodine in their food. Those people, if they have soy products, it will not cause any issues. Okay, soy has much more benefits than to be avoided. Okay, so why just not you can avoid soy? Because we have so much of evidence-based studies that suggest that soy, it can reduce the risk of autoimmune diseases, breast cancer, mortality from breast cancer, prostate cancer in men, hip fracture, cardiovascular diseases. Okay, so when you have one food that benefits you in all these areas, how can you remove it from your diet just because it causes hypothyroidism? Okay, that also it does not directly cause hypothyroidism. If there is a risk, then it can aggravate the risk. That's it. Okay. Then selenium. It's a micronutrient important for thyroid hormone metabolism. Richest source of selenium are seafood and organ meats. Okay, oysters, crab, lobster, all form of sea fish. Okay, are richest source of selenium. Typical sources in the diet are bread, grain, meat, poultry, fish, eggs, some nuts like Brazil nuts. Okay. Somebody had mentioned pecan nuts as well. I'm not sure about the pecan nuts, but Brazil nuts are a good source of selenium. Sunflower seeds as well. And some studies have shown benefit from selenium supplementation in individuals with autoimmune disorders. People who have low selenium, we have seen that they are at the risk of developing goiter and also thyroid nodules, especially when the study was done in European women. Okay, they did the study only on a specific ethnic group. Okay, European women. In them, it was seen all the women who had low selenium levels, they had a risk of developing goiter and thyroid nodules. So selenium and iodine is the only nutrient that is associated with the health of thyroid functioning. Other trace elements, zinc, copper, magnesium, are not that well defined. Okay, they are important in your body, but regarding the thyroid health, they are not that well defined. Okay. Some meta-analysis has suggested that there is a relationship between selenium, copper, and magnesium with thyroid cancer. That is deficiency of selenium, copper, and magnesium. If three of these deficiency exist in a person, it can lead to thyroid cancer. Okay. All the other trace minerals, just for promoting thyroid function is not generally supported. We don't have any research for that. Okay. Apart from iodine and selenium, we don't have any extensive research on any other minerals or trace minerals supporting thyroid health. Other dietary considerations: when you are having coffee, coffee can decrease the absorption of levothyroxine. If you're taking thyroid medication, levothyroxine, don't take it along with coffee. Okay. Coffee, tea, anything that has caffeine, alcohol, okay, avoid it. Then gluten-free diets, sugar-free diets, probiotics, okay, they are advocated for promoting thyroid health. Myths: you can't eat cruciferous vegetable if you have thyroid. Wrong. Even if you have thyroid issue, thyroid disorder, you can still eat cruciferous vegetable, but portion control. Okay. You should take iodine supplements if you have underactive thyroid. Wrong. Okay. Adequate amount of iodine supplements is good for health. Excessive is not. Okay. A gluten-free diet can help with Hashimoto's thyroiditis to cure it. It's not true. We don't have any strong studies suggesting gluten-free diet and Hashimoto's disorder, any relation with that. Myth number 4, weight gain from hypothyroidism. Maximum weight that you will gain because of hypothyroidism could be 3 kilos, not more than that. If you're gaining more than 3 kilos and blaming it on hypothyroidism, it's not the right way. It's your lifestyle and your calorie intake that is giving you too much of weight. It's not thyroid issues. Okay. People with thyroid disorders need to be on special diet. That is also wrong. So apart from iodine and selenium, so far, there is no other dietary factors that can positively affect your thyroid health. Okay, all the other trace minerals, we do not have a definitive conclusion. Okay, and much areas regarding thyroid health need to be researched even more. Okay, to put it into practice. So that's about thyroid disorders. If you have any queries, you can mention in the chat box.